The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
You are listening to the 5-Second Rule podcast presented by APIC, the Association for Professionals in Infection Control and Epidemiology. This podcast is produced by the APIC Communications Committee and is intended to be a conversation between our hosts and professionals practicing in the infection prevention and control industry. You will learn and be entertained, but most of all, we hope you will be inspired by our community and the work of our peers. And now, on to the show.
Welcome to the 5-Second Rule podcast. We are your hosts. I am Kelly Holmes, and my preferred pronouns are she, her.
And I'm Lerenza Howard, and my preferred pronouns are also she, her.
Today, we're joined by Trent MacAllister. He is going to tell us all the things about the abstract review process for the APIC Annual Conference. Trent is currently the APIC Annual Conference Committee Abstract Subcommittee Chair and also the 2025 APIC Annual Conference Committee Vice-Chair, and is an infection preventionist at the Washington State Department of Health within the Healthcare-Associated Infections and Antimicrobial Resistance section. Welcome, Trent.
Thank you for having me. I'm happy to be here.
I'm so happy to have you on the show, Trent. Kelly, say that that was a mouthful.
Right? That was a mouthful. That's a lot of words.
Absolutely. But it's so exciting to have you on the show. I know as someone such as myself who has submitted an abstract, I am ever so much intrigued about this process and for you to share insights regarding this subcommittee. So share with us, Trent, can you provide some information about the abstract subcommittee and share with listeners what are some of the requirements to be a member?
Yeah, absolutely. Before I jump into the abstract subcommittee, though, I want to talk about the APIC Annual Conference Committee, or also known as the ACC. So the ACC is responsible for planning the annual conference education program. So think about all of the speaker sessions that you see at the conference, including the keynote speakers. The committee is made up of about 12 volunteer members from various healthcare settings, anything from long-term care to acute care. And we also have liaison members from CDC, the APIC Education Committee, the chapter host representative, where the annual conference will be for that year, the APIC president, and then some awesome APIC staff. So shout out to Jen, Elretha, Damien, and Valeria. They do some great work with the conference. To be on the ACC, you must be an IP with a minimum of 3 years of experience, hold the CIC designation, and then you'll be expected to participate in some monthly conference calls, a few in-person meetings at APIC HQ, and then also to attend the conference and help moderate some sessions. So with that, what the committee does is the committee members review all of the speaker proposals and the abstract submission that are submitted to the conference each year. So when I say speaker proposals, those are things like the 30-minute sessions, 60-minute sessions, and then 90-minute workshops. And the abstract submission are either poster presentations or oral abstracts, which are 15-minute presentations. And so for a little context, that is last year, we received 426 speaker proposals and 365 abstracts for the annual conference, which is a big number. It's about 25% more than we had the previous year. And it's a trend that we love to see just because it means that IPs are excited to share the work that they're doing at the conference.
Thank you, Trent. I'm so curious to know, with that 25% increase, what do you think facilitated that?
Yeah, I think some of it is some returning to the normal work that our IPs are doing following the pandemic as we're kind of moving back to our baseline. And I think some of it is just the expansion of the work that APIC's been doing as well. So I think it's a little bit of everything. And I think people are having some time to write up those proposals again.
Yeah, and it seems like as though the subcommittee is very busy. How many members is on the subcommittee specifically? Because to have that number of abstracts and speaker submissions, it's pretty time consuming, I would imagine.
Yeah, definitely. And so the committee, it ranges from year to year, anywhere from 10 to 16 with those liaison members. And so, yeah, when you talk about the reviews, so each proposal, gets a minimum of 4 reviewers. And that means that every committee member must review anywhere from 80 to 100 speaker proposals in the fall, and then about the same number, maybe a little more in the winter, which coincides over the holidays. And getting through those reviews, it definitely takes a lot of hours on the nights and weekends on top of your regular work schedule. And once that review process is done, then the committee as a whole meets in person to review all of the submissions and come to an agreement on the proposals and abstracts that should be selected for the annual conference.
Wow, what a time-consuming process. And that does also probably explain why you guys staggered the submission dates for the oral abstracts and then the poster presentations, maybe to also give you some more time to review. So, you said that there were 365 abstract submissions and over 100 different oral abstract submissions. So walk us through a little bit about, what are some common mistakes in the abstract submission process? And then how many of those submissions wind up going live at the conference?
Yeah, absolutely. So by far the most submissions that are not selected is because of rule violation. So last year, nearly half of the abstracts that were submitted had a rule violation, and that led to them not being selected for the conference. Of those rule violations, the most common are not spelling out abbreviations, having several typographical or grammatical errors, if the authors named the facility that they work at, if there was incomplete data, if it was previously presented, or if it contained lists or incomplete sentences. And of those, by far, abbreviations are the most common rule violation that we see, but it's also one of the easiest to avoid. So absolutely use abbreviations, but you want to make sure that you're spelling out that abbreviation on first use. So even those common ones like IP or MRSA or APIC or CDC or ICU, anything like that, you want to make sure that you're spelling it out on first use.
Oh, wow. That is great feedback. And so is it just an automatic, that they get, taken out of the review process if that mistake is made, or are you able to give any feedback to the authors on their submission?
Yeah, so that's the important part of reviewing the speaker and abstract submission guidelines, because we have those up as reviewers while we're reviewing these abstracts. And so that's part of the review process. And then, as far as providing feedback, we do try and provide the most common reasons why abstracts are not selected. So we'll send that out in the notification letters, as well as there's a great APIC article by the committee from a couple of years ago that really goes into detail about some of those common reasons why abstracts are not selected. And then sometimes it comes down to it's just competitive. There's a lot of really great work happening out there, a lot of really good submissions. So for the abstracts, we accept anywhere from 100 to 150 proposals. And, out of 365, you can see that it gets pretty competitive too. So.
Yeah, so that's definitely, a note to listeners and those that seek to submit abstracts to ensure that the subcommittee is definitely adhering to those rules. So to have that side by side when as you're compiling your data and your information in formulating your abstracts is absolutely key, because of course we will want to at least have your research that you're working hard on presented or accepted if possible, and not to be rejected due to things such as that can be prevented. As we're discussing oral and poster abstracts, how does the committee determine which will subsequently become an oral presentation versus a poster presentation?
Yeah, so this is another question that's specific to the abstract subcommittee. And so when authors are submitting their proposal, they have the option to select either a poster-only presentation or a poster or oral presentation format for their abstract. And so depending on what the speaker selects, we try and honor that as much as possible. And then looking at our previously accepted speaker proposals that we went through in the fall, so those 30, 60, and 90-minute sessions, if we see any gaps or areas or topics that are not covered, we'll try to kind of round out the program by finding some of those abstracts for orals that way. And then another way is sometimes just the format of the abstract might lend itself more to a poster versus an oral abstract.
Yeah, thank you for sharing that. So say, for example, if someone submits their research and they intend for it to be a poster abstract, what additional work would that entail if they were selected to subsequently transition into a oral presentation?
Yeah, so with that, the oral presentations are 15 minutes and they are put into a 1-hour time slot with 2 other speakers. So there's 3 15-minute sessions and then some time for Q&A afterwards. And so that transition from a poster to an oral abstract would consist of creating some slides or a slide deck and giving kind of a 15-minute presentation on your abstract, as opposed to having your abstract in a poster format.
Oh, that's great. Lots of opportunities to share your work. So you had mentioned that the author or the speaker can pick their track that they believe that their work falls under, or the heading that it falls under the best. So tell us a little bit more about those tracks. Does the committee change the tracks every year, or how are those tracks selected?
Yeah, so the tracks, they're meant to align with the APIC IP competency model, as well as the CBIC topic areas. And so, as you mentioned, applicants self-select their track based off of their topic or their proposal content. And those tracks, as far as I know, have remained the same since I've been on the committee. And the committee does have the ability to reassign a proposal to a different track if it's not kind of in alignment with what the track is describing, but that happens pretty infrequently. And then those tracks, they're really important because it helps round out that education program at the annual conference. But it also helps the attendees choose what sessions or posters they're going to view.
Oh, that is very helpful. So you wouldn't get disqualified for accidentally picking the wrong tract for your submission. But what if you're like, I have no idea? Is there any kind of guidance out there for, helping someone choose which tract would be best?
Yeah, definitely. So if you are in that situation where you're not quite sure where you might fall, if you look under the speaker submission guidelines, it gives some examples of what those tracks, kind of like a more detailed description is. So for example, I'll just say emergency preparedness, and an example of that would be outbreak response or recovery.
As it relates to, areas that may have been understudied, possibly in the field of IP, I know, for example, one thing that I found very intriguing when I went to the APIC conference last year was that I networked with an IP that actually works in a prison. And of course, this was my first and only IP that has ever worked in a prison. And I don't know if there's any literature out there regarding this specific field. So I'm curious to know, is there any area of IP that from your purview has not been widely studied, and or, maybe conversations with the subcommittee, you've identified areas of improvement in conducting further research?
Yeah, I think that's great that you called that out, is those infection preventionists in our, non-traditional healthcare setting. And that's something that, as the committee, we're always keeping an eye out for, is those new topic areas where they are. So some things like sustainability in healthcare and building green buildings is an example of one session that will be at the conference this year. Those sessions on One Health. And then, as you mentioned, those IP in non-traditional settings. So a couple of examples of those, there was last year a presentation on an outbreak of NDM E. coli in veterinary clinics, which had that kind of interface between humans and animals. And so that was a really interesting one. And then another one was regarding a large foodborne outbreak among rideshare drivers at festival. So while it's great to have those new cutting edge or new ideas, by no means is that a requirement to submit. We love seeing the hard work that IPs are doing day in and day out. And we learn just as much from those sessions, if not more, than those novel sessions. So, and another aspect of that is that you don't have to publish something that worked. You can publish a project that you worked on, and let's say you implemented an intervention and it didn't curb your outbreak. That's okay. We want to hear those stories, because someone might be working on the exact same thing and trying the exact same process as you. But then when you're sharing those experiences, you can brainstorm and come to maybe find a new conclusion.
Yeah, thank you, Trent. I'm glad that you shared that, because I know that that's something that I try to share with people. We love and enjoy sharing those successes, but in research, you can definitely learn from those failures. There's definitely aspects that we can learn from in that regard. But so I think that that's definitely a source of knowledge for listeners to also pursue submitting those projects that may have failed and not worked out so well, and really discuss the limitations and or areas that would garner further research.
Yes, I know that if I am trying to figure out a problem in one of my facilities or trying to support someone and something has happened, we turn to Google and, we start looking up the abstracts to see like, well, has anybody else had this problem? And if so, what did they find? But it's also extraordinarily helpful to have what did not work, so that it will save you time and your team time. So that is, yes, thank you for sharing that. So what advice, Trent, do you have for someone who maybe has never submitted an abstract or maybe has some limited resources?
Yeah, that's a great question. So first, I'd say start identifying your topic. It can be a project that you've completed in the past or something that you're currently working on. As long as you're not going to be putting in there, this project will be left to further data collection, or as far as drawing conclusions comes, it can be something that is not done right when you submit that proposal, because for some of those speaker proposals, it'll be submitted in August or September, and you'll have until the conference to finish that. And then with the abstracts, it might be submitting in October, November, and again, you've got until June. So find that project or that topic idea. And then the next good thing that I think is helpful is to look at some of the previously submitted proposals. And you can find those on the APIC website. All of the previously accepted proposals for the annual conference are published in the June supplement of APIC, along with the abstract award winners. So you can kind of get a sense of the topics and the style of writing that past abstracts have had. After that, and this is what I would say is one of the most important, is really read through those submission guidelines and get a sense of how to submit the proposal. The submission guidelines, they spell out that how to submit the proposal, but also has a timeline of the process and then those requirements to follow. And again, those requirements are really what the reviewers have in front of them when they're going through these proposals. So pay attention to that. After that, yes, that definitely is an important part. And then after you've drafted a proposal, I think it's always good to try and reach out to your local APIC chapter. They might have resources to help you, whether that's a journal club or a writers group, and there might even be a past committee chair who's willing to help take a look at your proposal. And then the last thing I always like to do is just have a friend or a family member, someone who's not an IP, read through your proposal and check for any spelling or typos. And then after that, upload it and time to celebrate.
Yes. And how many words are the proposals supposed to be, or what's the word count requirement for those?
Yeah. So for the speaker proposals, and I believe the abstract proposals, it's about 300 words. And so with that, what I recommend doing is writing your proposal out in Word. And how I write is, I'll just do a little bit of word vomit and I'll write it all out, and it might look ugly, but then I'll go back and edit it. And it might be, on first draft, it might be 500 words and you've got to cut it down. But yeah, just work on getting it out and then trimming down to that word count.
I definitely attest to that word vomit, the way you phrased it, Trent, that aspect, because I definitely will complete that, as many words. And then that really, at least in my perspective, it really assists you with being more concise, because you can weed out the verbiage that's not necessary and really clearly and concisely, relay the information that you need to share. But one additional maybe recommendation that at least I will provide is, if you see even if you don't want to submit an abstract, and or if you do and you feel as though you need additional resources, possibly reaching out to those respective authors, via LinkedIn or any other information that they've shared on their respective abstracts, and reach out to them regarding, their research study, and to see how best that can potentially help you if you intend to submit an abstract as well.
I love that advice. Yes. I think, it can be extremely challenging when you've done a year's worth of work, or maybe multi-years worth of work, and now you're submitting it in 300 words or less, so that is a huge challenge, I think, in writing those abstracts. But on the flip side, it is only 300 words. So yes. Everybody give it a shot. So Trent, for individuals, once they have submitted and hit that send button, and now they're celebrating and taking a breath of fresh air, what is the next step? What should they expect if their presentation or abstract is accepted, or on the flip side, if it is not accepted?
Yeah, so once you've submitted, then what happens is it goes to the committee for review. And the committee members have about 2 weeks to do those reviews. And then we'll have that in-person meeting that I mentioned. And so that review process can take about a month or a month and a half. And so that's kind of a, timeline for you, is you'll have about a month and a half before you'll hear anything. And then you'll receive an email from APIC notifying you of whether your submission was selected or not. And in that email, it'll contain kind of information about the format of your presentation and instructions on when and how to submit either your slides if you'll be doing an oral presentation, or how to format your poster if it's a poster presentation. And then you'll also be asked to provide your bio and a photo and a couple other conference materials as well.
So individuals, many may ask, why should they complete an abstract? I know, at least in my experience as an IP, many of us we're just doing the work, right? We're collaborating with various stakeholders. We're doing the work, but we're actually completing and conducting and partaking in various projects that would definitely be of use to the field if submitted as an abstract. So Trent, share with us, why should anyone consider submitting an abstract?
Yeah, I think because you've been doing that awesome work and you should be proud of it. And like you mentioned, IPs, we learn so well when we share our stories and learn from each other. And submitting an abstract is a great way to do that. It also is a good way to show your boss or your organization your value. You can use it as a reason to let your organization send you to the annual conference. And then also, as I mentioned, those abstracts are going to be published in APIC. So you'll be a published author after that. And then with the speaker proposals, some proposals that are accepted also receive assistance from APIC to attend the conference. So it's kind of a good way to, if you've always been wanting to go to the conference, a good way to get your foot in the door. And then with the last part too is with abstract submissions. Each abstract that's selected for the conference is also considered for an abstract award, which can include an award prize. So there's a lot of good incentives to submit it on top of just being proud of your work and sharing that with other IPs.
Definitely. So I hope that, upon listening to this episode, those under the sound of our voice will consider submitting an abstract if you've never done so. And hopefully we will see your work in 2025 at the conference. So I thank you and appreciate you for your time, Trent. And I also want to extend my deepest gratitude to you and other members of the subcommittee for the rigorous work that you all put into assisting with approving and disproving, the abstracts that will be shared with us.
I echo Lorenzo's sentiment. I am extremely excited to see what will be at the conference this year and really appreciate. I really had no idea behind the scenes and hadn't thought about it deeply, how much work goes into it and how many people volunteer their time to bring this work to the masses. So yes, thank you very much for sharing all of those tips and tricks for the abstract submission process, and look forward to it.
Yeah, well, thank you guys so much for having me on. And I just also want to shout out the annual conference committee, all the work that they do. They are very inspirational, and I learn so much from them every time we meet. And so big thank you to all of the committee members too.
Amazing. Thanks, Trent.
Thank you.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.